Welcome to another episode of Eclectica, the different news, and I have my beautiful, gorgeous guest, Camille Zenobia from New Jersey. She is the CEO of Salutem LLC. Camille, welcome to the show, and thank you so much for accepting my invite and being here. As my guest on this podcast, I'm really, really honored. So, and in an Indian way of greeting is Namaste.
Oh, thank you so much. I'm so happy to be here. I'm always thrilled to talk oral care and talk about the oral microbiome. I could do it all day, so I'm happy to have an excuse to talk some more. Thank you.
So Camille, I as far as I have seen your experiences noted down on the LinkedIn profile, but I know you have a lot more than that hidden inside. But then it's very interesting story. I think I find your career very interesting. So can you share your journey, your career, and right from your research assistant part, from there you came up such a nice way, and you became a medical science liaison, and now you are the CEO of Salutem. I think this itself is very inspiring. So I'm really excited to know your story. Please, if you can share your story.
Thank you. Yes, I can definitely share my journey. It is an unusual one. I basically started with the idea that I didn't know what I wanted to go to college for. So I actually started as a hairdresser, as a cosmetologist. So I was trained in skin and hair, and had about 20 years career in that arena, where I opened a couple spas in Seattle, worked for many, many years in the Seattle region, and I was an educator for Aveda. I taught in the area very lightly, but it was actually working with Aveda that got me interested in the science aspect of product science, actually. And so from there, I started going back to school in chemistry. I finished my undergrad, and I then pivoted from hairdressing to research. So I was a technician at University of Washington and also Fred Hutch Cancer Research Center, where I was studying host pathogen interactions with Aspergillus, which is a fungal infection. I went on to evaluate some options for HIV vaccine. So those were all very fun. So I entered graduate school at the University of Washington for a PhD in microbiology, with the intention of studying that host pathogen interaction, specifically to kind of dig into the question of why some people get sick and some people don't, given the same exposure. And so it was actually at University of Washington that I landed myself in an oral periodontal lab. So we were studying Porphyromonas gingivalis. We had other periopathogens in there, but broadly, I was looking at germ-free mice and how the oral microbiome impacted them, and also specific pathogenic features of Porphyromonas gingivalis. And then from there, I went on to a postdoc at University of Pennsylvania with George Hadji-Shingalis. And I only lasted about 2 years before I ended up in industry at Colgate-Palmolive, and I worked for 5 years there from bench, researching kind of new aspects of older technologies, evaluating kind of what they could be doing with the understanding of today, what we know about the inflammatory pathways, if any of our technologies would impact in a positive way. And so that's what I was evaluating, and we moved some of those inquiries from the bench to the clinic, where I ended up in the clinical development team, running clinical trials. So I just had a really wide breadth of experience there, and I'm so grateful for that time. I've since pivoted back into, during the pandemic, I went into medical science liaison role. It was tricky because I was in infectious disease again, and that was a terrible time to be trying to talk to infectious disease people in 2020. So it was a rough go for a minute, but I landed kind of softly at Allergan and where I still maintain a career there as I grow this new company, Salutem, which is oral health, basically in Latin. And our whole premise is that because we understand the pathways of inflammation in the oral cavity, we have some new technology that we're bringing forward in an oral hygiene care regimen, and I'm excited to be launching very shortly here.
Fantastic.
So that's
I think
origin story.
No, I think it's extremely inspiring, and I think by learning about your journey, one sentence that comes to my mind is everything is possible on this earth. So, I mean, I don't know, really, it's so inspiring. So, well, then I think we are going to have a lot of discussions today, and I have a lot of questions to ask you from the area, because I am also personally very inclined towards oral cancer genetics or microbiome, and per se all about the intricacies or unknown or not what we cannot see with the naked eye in the oral cavity. More interested with that area. Yeah. So can you just let us know, like, in recent times, what we are seeing, that in recent years, a lot of things, lot of focus has grown on gut brain connection. So is there a similar connection that oral microbiome and other aspects of health beyond oral health, is there a connection similar to what we talk so much about gut microbiome or gut brain and gut health and stuff? What is your take on this?
Well, I have a lot to say here. I did write a review in this area, but briefly, I would say that it is a two-way street. So the inflammation is the main driver of oral pathology. And it doesn't really matter what side of the landscape you're talking of, if you're speaking of a local trauma in the oral cavity, or if you're talking about systemic inflammation that then drives oral pathology. So we know that patients with cardiovascular disease and type 2 diabetes, if they didn't have oral pathology to start, they will be at higher risk for developing that oral pathology, and vice versa. When you have periodontal pathology starting but no other pathologies, you will be at higher risk for developing cardiovascular disease and type 2 diabetes as examples. And now we're talking about Alzheimer's as like a type 3 diabetes. So it's all kind of related to this backdrop of inflammation. So when I think of treating the oral cavity, I'm thinking of, where is the inflammation coming from? Is it local? Is it systemic? Where are we going to put our effort? So yes, it's all related. It's all one body. I would say that our food product landscape is probably most to blame for all of these pathologies driving inflammation overall. But there are other ways to get to a chronic inflammation story. Diet is just a major one that is hard to control, as you may well know.
Yeah. Thank you, Camille, for enlightening us on that area. Camille, like whenever we talk about health, oral health, and diseases in particular, inflammation is a very common term. Even now, lay people understand that probably. So it often comes in discussions about health. So how does the oral microbiome relate to inflammation, and how does this impact our overall health? Can you please enlighten us on this area?
Yes, absolutely. So if you have oral inflammation, what happens to the microbiome is these oral inflammatory proteins that drive inflammation and continue to drive inflammation become food for those what we call perio-pathogens. They're actually commensal bacteria that typically live in low numbers because we're not supposed to have all this inflammation. So I think of these perio-pathogens like Porphyromonas gingivalis, for example. They can utilize those inflammation proteins as food. When you're providing this ongoing food source, they're going to thrive. And as they thrive, these pockets gain hold. They gain deeper access to kind of oxygen low environments in these very deep pockets, and they're very successful. That's where they thrive. And so if we treat the inflammation, we're starving them of the food that they need. And so if we can starve them of the food they need, they'll kind of go back to their commensal type profile, and that homeostasis will start to come back into balance. So that's how I think of inflammation with the oral microbiome. When you have that chronic inflammation, when you're feeding those perio-pathogens, they grow in abundance and we're swallowing them all the time. And it has been shown that as you swallow more and more Porphyromonas gingivalis, for example, you can create a gut dysbiosis that then leads to a leakage of LPS, lipopolysaccharide. And when lipopolysaccharide is released into the vasculature, it can create a whole lot of problems. And this is where we get chronic inflammation in our vascular. And this basically is increasing your profile risk for cardiovascular disease, because that LPS is creating increased inflammation, increased propensity for aggregate materials in the vasculature, which will then impede the flow and create some of those plaques that we see in cardiovascular disease.
Thank you, Camille. That's really a very nice way you have explained us. It's a critical science, but I think it's a very simplified way you have put across. So thank you for that. So as you were talking about diet, and yes, obviously, lifestyle and diet, all these things, and oral hygiene play a very vital role in oral health. So what do you think, like, how is there any influence of these factors like diet, lifestyle, oral hygiene on the balance of oral microbiome, and probably its potential to cause or prevent any of the inflammation or inflammatory diseases per se?
Yeah, that's the tricky part. Is so we know that obviously sugar is a terrible thing for our oral microbiome, because it'll increase the acid profile and create cavities. But the inflammation side is probably more on the systemic aspect, where we have a Western high-fat diet with sugar involvement. It's kind of creating this perfect storm for a low level of chronic inflammation, which then drives oral pathology. So when you have kind of this, when you have obesity, any weight gain, that extra fat can release inflammatory mediators that can then go systemic, and like I said, that can feed oral pathology. So if we think about the systemic piece, what is happening is you have these white blood cells moving through your vasculature. If there's inflammation there, they are sensitive to it, and they become primed. And so what's happening there is that your gingival tissues are actually highly vascularized, and you have white blood cells coming through. It's around, I think it's 40,000 neutrophils per minute coming through your healthy gingival tissues. When you have pathology, it increases a whole lot. And in fact, you can correlate the number of neutrophils to your overall inflammatory load. And that's something that Dr. Michael Glogauer at the University of Toronto is doing. He's actually coming out with a device that will be a chair-side salivary diagnostic to evaluate your neutrophil load, so that you can kind of get a quick assessment of what your inflammatory load looks like out of your saliva, which is going to be a great tool for the chair-side practice. But in any case, what happens there is when these primed white blood cells are moving into your gingival tissues, if they're already primed, then they're really going to be angry when they start to see oral bacteria, because they're already kind of on the alert for danger, and they're going to be more reactive. And actually, Michael Glogauer has done a lot of animal study and translational science to show that if you have an insult in your gut, and then you stimulate oral pathology, you'll get an exaggerated outcome because those white blood cells are now primed. They're just angrier and more sensitive and will create more damage by that interaction with the oral microbiome. And again, those inflammatory moments will feed those commensals, turn them pathogenic, and create this chronic opportunity for chronic ongoing inflammation. So you really have to be mindful of both sides of that equation if you're going to be an effective oral hygiene assistant, we'll say.
I think you touched upon a very exciting point for me, particular because I'm a saliva diagnostic enthusiast, and
excellent.
Thank you for sharing that very valuable information. And probably when we again do the next International Saliva Summit of India, SALSI, which I have been doing for the past 5 years now, I think again I will definitely come back to you and have you as a guest. Obviously, that's very obvious.
I would love that.
Yeah. So Camille, well, we will talk more about science and stuff, but yes, this is also very much related to science. So please tell us about your new venture, Salutem, and like how you are driving innovations oral to improve the related oral health, and what are your specific initiatives through this company which will help us in our understanding of probably oral microbiome and connection to inflammation, and probably a lot more. So I'm very interested to know about that.
Yeah, I would love to share. So I stumbled upon, because I understand these pathways of inflammation, I'm always kind of deep diving into the literature to understand how we can kind of interrupt some of these cycles. So with those chronically activated neutrophils, how can we kind of throw them another way? So what's happening is these neutrophils, these white blood cells, are chronically activated, which means they don't die easily. They're just hyper alert. They spew out a lot of enzymes that will degrade tissue and bacteria alike. They're just hot. And if we turn them down, if we're able to induce apoptosis, which is a nice cell death program, what that does is it initiates a wound healing cascade that then provides a cleanup service by macrophages coming in and basically starts that whole repair cycle. And if we can get those hyperactivated neutrophils to go to that quiet apoptosis and inspire that wound healing repair cycle, then we can start to get a handle on this chronic cycle of inflammation. So I had found that there is niacinamide, which is actually vitamin B3, and it is a natural way to induce that apoptosis in that chronically activated neutrophil and allow for that wound healing cascade. So basically, Michael Glogauer has done a little bit of work to evaluate neutrophils from periodontal patients to show that this phenomenon is true. We have yet to do a full clinical study, but I did some consumer testing to show that the consumer testers that had oral pathology showed an improvement from 3 to 4 months of use. That's basically between dental exams, dental cleanings. And so they experienced smoother teeth, their pockets improved, their probing depths measurements improved, bleeding on probing improved. And so we're really hopeful that a full clinical trial will be productive, but that's kind of where we're at as the clinical success part of this story. But the other part of the hygiene story is that skincare holistically, about 10 to 15 years ago, underwent a whole kind of reorganization of their ingredient profile. It was finally acknowledged that most of the products on the market had some level of irritant in the lotions and such. And so the all of the dermatological products have gone through a revival to simplify the ingredient profile, really have gentle but effective ingredients and less fragrance to help minimize the issues that were coming up, sensitivity issues, because we're trying to solve a problem, not create a problem, of course. But oral care hasn't really undergone this revival that skincare has. And yet we know that many of the ingredient profiles in our oral hygiene products can be irritants for some. So I think of oral care in the same way I do as skincare, where it is a topical application, and there are varying levels of sensitivity in the population. Not all of us are the same, obviously. Some of us have skincare sensitivities, and some of us have oral hygiene care sensitivities, but it's broadly gone unnoticed. So we know that stannous fluoride can be very irritating for some. I actually worked with somebody who couldn't test our own products at Colgate-Palmolive because they were particularly sensitive to stannous. And so this is just something that is not, I don't find a large awareness for. But if we are putting stannous fluoride on our patients that have gingivitis or periodontal disease, but we aren't mindful of the potential sensitivity, if we see that this patient isn't resolving, we may just need to pivot the oral hygiene aspect of the show to get resolution. It might not be as difficult as we're kind of making it. Potentially, we just need to kind of try a more gentle approach because not all of us are the same, and we could have some sensitivity. So my goal for the oral care hygiene kind of revival is to simplify that ingredient profile, have very gentle ingredients, and provide an active that we think is a provocative way to turn down that hyperchronic inflammatory pathway and intervene at a more gentle level. So that's kind of my proposition for OSA, which is the brand that we've created in Salutem. And my brand is, I would say that I have a lot of ideas to kind of increase the technology. So there's a toothpaste that has niacinamide, but the mouth serum has a little bit of niacinamide and hyaluronic acid. And we know that hyaluronic acid is a benefit in the dental arena. It has been used for many, many years. There's lots of clinical study. And so the combination of hyaluronic acid and niacinamide together, the hyaluronic acid is acting as a delivery system, but also has a wound healing capacity of its own. So it's kind of a 2-for-1. It already has a clinical profile that we know can improve ulcers, mouth ulcerations, and calm down any kind of hot spots in the mouth. With the coupling of the niacinamide, I'm hoping to get that kind of synergistic effect. So, and it's also not a mouthwash. There's no alcohol. It's just meant to be a salve of sorts for your mouth.
I think it is so interesting, and I think it would be something really helpful for people, and the thought process that you have, applied, I mean, it is fantastic. Camille, the thing is that now we talk a lot about, like, as you were also telling, that it is not, everything is not same for everybody. So in present time, I'm sure that the field of personalized medicine has been gaining a lot of momentum. So I had a query in my mind, like, is there a way, or is there something like an individual oral microbiome profile, or perhaps if we have this type of a profile, then is there a contribution in tailoring oral health recommendation on a personalized level? So what do you think on this area?
I think that there's a lot of promise with the kind of microbiome DNA evaluation. I know that people have been treating, successfully when they see a kind of unusual DNA profile and treating specific bacterial species with antibiotics, for example. I'm not opposed to that. I think that that is it can be a wise approach for some people with really impacted by oral pathology. However, if you are able to get a handle on the inflammation, you may not need to go into that DNA evaluation, because so my hesitancy around the DNA microbiome story is really that we can't expect something like, I bring up Porphyromonas gingivalis just because I worked so much with it, but it's also a really good example because we know so much about it. If we get it back to its homeostasis profile, I suspect, because we've evolved with it for thousands of years, that it has a beneficial aspect that we don't fully understand. And to think that we're going to eradicate it is possibly foolish, and it might turn around to bite us if we don't really fully understand the ecological story there. And we know that there are extraordinary strain differences between different Porphyromonas gingivalis strains, some of them being more pathogenic, some of them being less. And again, I don't think we know the full story. I think we know little pieces, and it's complicated. So to think that we should get rid of it entirely because some of them are bad, I think is quite foolish. And so if we are mindful, I think the DNA approach could be useful for kind of a really bizarre skew. Like if you're not getting the inflammation down, if you're having a hard time, you've tried all the things, I would definitely run a DNA panel just to see. But I think it's only part of the story, and we have to think about the oral cavity as this harmonious ecological system and not this one bad bug is getting us. Because I think it's the inflammation and the acid profile that are all lending to that overall health homeostasis potential.
Wonderful. Thank you, Camille, for sharing your insights on this very much talked about aspects, because a lot of, as you said, that a lot of companies who are working with microbiome DNA and stuff, these are coming up, and I think it's time we really need to revisit our knowledge, and we need to, as you rightly said, that we have pieces of knowledge, and probably with years in the future coming, which is a very bright future for all of us when it comes to diagnostics. So probably we, get the puzzle, solved with
Right.
all these pieces joining. Yeah,
I'm really looking at kind of the AI coupled with large data profiling to help us solve some of these larger, coming at it from a holistic perspective. It is hard to kind of capture all of the moving parts, but I have hope that we're getting there.
Correct. Camille, I think we are almost at the concluding part of our conversation, though I don't want you to go away, but then yes, we have to close this conversation somewhere. So what is a last question probably, that what is your vision for the future of oral healthcare? Because you are in this space, you are doing a lot of research, and you have come up with your own, breakthrough solution. So, what do you think, or what is your vision you think would be the frontiers when it comes to oral microbiome, its management, in terms of improved oral health and overall health in the coming decade, probably? So, can you please share your understanding?
Yes, I have lots of plans. I do see this in kind of the personalized medicine space, where I would like to see the dental practice kind of move into that more holistic approach. I don't expect them to own the systemic piece, but to have some awareness and cataloging of those systemic pieces in order to have effective conversations. Now, this doesn't mean that I want to see the dentist sit there and talk about diet and exercise, because I think we've all felt like our physicians are, giving us lectures full time. Yes, we all know. But are there tools that we can use to show that by intervening and having these conversations, we're moving a needle? So are the conversations, when we have an oral load evaluation, getting their buy-in for understanding what that means and their risk profile on the systemic side, maybe having a little finger prick test for the dental chair side visit would be a really nice way to couple the two. And so that when you come back over and over for your checkups, you have both the oral piece and the systemic piece with a real-time, evaluation to see that you have affected some outcome. And if you haven't, to continue that conversation and, get creative. But I do and would love to see more innovations, creative solutions for oral hygiene products, because a fluoride toothpaste is a one size fits all solution that hasn't worked for everyone. So we know that India, for example, has hotspots of natural fluoride, and we can't be bathing people in fluoride and still having poor oral health outcomes. We have to get creative here. We can't just rely on one active. That's preposterous, right? We know we have to get creative. We have to understand that there are ingredients that are just irritants and that we should maybe dial those back. Have options for the sensitive folk and really start to treat it like a skincare regimen. I think that would be most appealing. Like right now, we're trying to scrub out a toilet, and our mouths are not a toilet. It's a safe place to be. We want them to be beautiful and cared for and nurtured. We're not scrubbing them out like a smelly toilet. That is not what we're doing here, and I think we need to change the messaging here.
Thank you, Camille. Thank you so much for this insightful conversation. It was wonderful talking with you and discussing such an upcoming and interesting field of science. And I wish you all the best and all success to your venture with Salutem. And I hope we meet in the future again to have such mind-blowing conversations. And probably, definitely, if destiny permits, we meet someday in person as well.
That would be amazing. I would love that.
Thank you, Camille. Thank you so much for your time.
Thank you so much.